Good evening, folks. Welcome to this channel of the Department of Psychology, Dr. MGR Education Research Institute, deemed to be University. I am Manoj, the psychologist. Today, our topic is going to be on the 4 critical professional skills essential for psychologists. And in this particular video, we are going to talk about one of the most important skill, the primary skills that is essential, which is case history taking and mental status examination, or MSE. Today, the profession of psychology, the approach of providing psychological support or psychological intervention has been penetrated by a number of non-professionals and professionals in the field relevant to psychology, but who are not actually uh, who don't actually have in-depth knowledge on how to go with the psychological interventions and provide the appropriate psychological therapies. Today, many underqualified people, people who don't have qualifications, people who are not trained properly, claim themselves to be psychologists, counselors, or they may use many other different names like behavior modification therapists or life skills trainers, or sometimes even wellness promoters. And in all these uh, identities, in all these with all these labels, they try to provide psychological support, and because they are not properly trained in the field, they don't have proper exposure or proper knowledge in the field. It is not that the support is not going to give results, but the problem is that the whatever support they give, it may give a temporary relief to the patient, because of which he may feel that fine, I mean, things may get better for him. And but because the cause is not addressed, what actually happens is that the relapses can happen anytime. And when relapse happens, when the patient returns to his condition, the, the reality is that they lose confidence in the field of psychology. They lose confidence in psychological intervention process itself. They lose confidence in themselves that they can ever become better and lead a normal life. Just an outline of the 4 important skills that is essential. One is case history taking and MSc and case formulation, about which we are going to talk about in detail in this particular video. The second one is psychometric assessment. Third is report writing. And finally, the fourth important one, identifying and administering appropriate psychological therapies. Case history taking is a detailed account of the current psychological condition of the patient, the physical and psychological environment which the patient is currently in, which may be contributing to his problems, or sometimes which would have been the core reason for his problem, the possible genetic and the hereditary factors that would have been the cause of his problem, then the psychosocial and medical history of the client in detail to understand the causes. Basically, we are going to talk about from the biological perspective, from the psychological perspective, from the social perspective, and also from the cultural perspective. We try to get all the details related to the patient, both in the present and his past experiences, which can help us or guide us in the road of understanding the person's problems and what has contributed to the current condition. And also, because we will be able to find out what has contributed to the current condition, we will also be able to formulate proper intervention approaches for the client. Mental status examination is the situational evaluation of the nature and intensity of the symptoms and the current cognitive functions of the client in the clinical situation. When you are talking about the intensity of the symptoms, the patient or the client may come with a number of symptoms. We need to identify what are the symptoms present and what is the actual intensity of the symptoms through a simple screening process which is done in the mental status examination. Identifying the intensity of the symptoms can only help in deciding how we need to proceed with the patient. Also, we are assessing the current cognitive functions of the patients, which includes attention, concentration, memory, judgment, judgmental abilities, abstract thinking, and also to what extent the patient is aware of his illness. These Understanding these factors helps in deciding whether the patient can be subjected to a psychological intervention or whether he needs a medical intervention at the initial phase, and also whether the client can be subjected to any type of psychological assessment, and whether the client will be able to respond properly to psychological assessment, because of which we may be able to get the results what we need to get. The other important function associated with case history taking and mental status examination is case formulation. Case formulation is the process of generating a comprehensive structured data of the factors that has led to the development of a condition and the factors that, that are contributing to the sustenance of the condition based on the information we have collected from the case history and also the mental status examination. Usually, we adopt two major models in case formulation. One is the biopsychosocial model, and the other is the diathesis stress model. Biopsychosocial model is usually used in most of the cases where we find from the case history that there is some background based on the childhood experiences, based on the medical history, based on various other conditions related to the past, based on the hereditary. Whenever we find that these factors are available, then we use a biopsychosocial model in which we are going to look at the biological factors that has led to the illness, the psychological factors, the social factors, the cultural factors, and associated with the emotional factors also, which has the emotional environment that has also led to the development of this illness. In the diathesis stress model, we usually deal with one factor, that is the genetic or the hereditary, and the other factor which is stress. So here this model is usually used when we find that the symptoms had started all of a sudden, it and condition which is acute without any background or without any history of any pressures or any type of problems in the history of the client. If you need to become a professional psychologist, then it is essential that you actually acquire the skills in case history taking, meta-status examination, and case formulation. But this skill can be best acquired only if the person has adequate theoretical knowledge about the various factors that can contribute to, to any type of psychological conditions. And also, the person or the person who wants to develop into a professional, they should have a real-time understanding of various type of physical, psychological, and social environment, how it affects people in different manner, and how people with different personality traits perceive their environment, because it's not just the environment that contributes to any type of psychological condition, it is also how a person perceives his environment that has a major role to play. Even the adverse environment can be sometimes accepted by somebody, can people can use it to their advantage, and sometimes most congenial advantage, environment can also be felt as threatening. So it is not just the actual environment that is available, that is present, but also how people with different personality traits perceive this environment, decide how it affects them. So having a clear, proper understanding and knowledge of these areas is essential to acquire the skills for case history taking, mental status examination, and case formulation. To develop the skill into your professional expertise, which can help you to get the proper understanding of the patient and the causes of the problems of the patient, you can develop it only by practice and by repetition of the practice and with the experience of seeing the clients from with different personality traits from different environment. A proper expertise can develop only if this exposure or training or the experience happens under a qualified, trained professional psychologist. So, if you are looking at becoming a professional in the field of psychology, if you want to really contribute to the profession and also to the people in distress in the right way, in the appropriate manner, then one of the essential skills or the most essential skills you need to develop is the case history taking, the mental status examination, and case formulation. Thank you.